very well said by the previous speaker that the shoulder is a more of prevalence injury, not of much of acute injuries. The more prevalent regions are shoulder and knee. This is more common in female athletes. This is the study on the elite women's T20 cricket that the greatest incidents occurred in shoulder in females. And this is another study of 2019 which says that 18% of cricketers sustain a shoulder injury at the rate of 0.19 injuries per player per year. So the shoulder injury in cricket, the bowlers are more susceptible to shoulder injury, but the predominant activity causing shoulder injuries is fielding, mainly from the throwing, and the increase is anticipated. We should know the how to rehabilitate before we should know the anatomy of the shoulder joint, that there are basically four joints which constitute the shoulder joint, and there are two groups of muscles like scapulothoracic muscles and this glenohumeral muscles. Out of these rotator cuff muscles, they are the very important, they are dynamic stabilizers of the shoulder, that when you are doing some action, throwing action, it is because of the rotators that the humeral head is centered on the glenoid. So there is concept of force couples in the shoulder. It is called the force couple occurs when several muscles work in unison by applying differing forces to create a common motion. And there is a force couple between the deltoid and this rotator cuff muscles, and there is force couple between the external and internal rotator of rotator cuff. And the overhead athletes, they usually have weakness of the external rotation strength. So you should know that the normal shoulder motion occurs by a coordinated pattern of the scapulothoracic, glenohumeral, acromioclavicular, and sternoclavicular joint, and this is called scapulohumeral rhythm. And in the full limb elevation, there is a three-dimensional rotation of scapula and clavicle, which is upward rotation, posterior tilting, and external rotation, and which ensures that the coracoacromial arch is removed from the path of the greater tuberosity and it does not cause impingement. So the rotator cuffs, they stabilize the humeral head on the glenoid and they work in eccentric mode. So you should this says that the eccentric training of the rotator cuff is very important for rehabilitation in shoulder. And one point is why full can and why not empty can. I have seen many physios doing the empty can exercises for strengthening of the rotator cuff, but the science says that you should do the full can exercise instead of this empty can exercise because of so many reasons. And for the supraspinatus, you do this full can exercises and prone full can exercises. These are the type of you should do the full can exercises, not the empty can exercises. And infraspinatus and teres minor, they cause the external rotation and they cause the remove this greater tuberosity from the path of coracoacromial arch. And these all the exercises, they should be done in the scapular plane. There are three type of exercises for the infraspinatus and teres minor: side lying, prone external rotation at 90-degree abduction, and external rotation with towel roll. These are the type of exercises: side lying, prone external rotation, and external rotation with towel roll. This last exercise is very creates a good balance between external rotators and the adductors of the shoulder. For the subscapularis, they say that you should separate the large muscles, interrotating muscles, from these rotator cuff muscles, and you should do exercises in this 90-degree abduction. So the 0-degree abduction or 90-degree abduction and internal rotation diagonal exercises. These diagonal exercises, they are very commonly used in the later part of rehabilitation. The deltoid, you should not focus more on the deltoid strengthening so much, because the deltoid causes the superior migration of this humeral head. So you should focus more on the this rotator cuff and not on much on the deltoid. Serratus anterior is very important muscle because it contributes to all components of arm elevation, which can includes upward rotation, posterior tilt, and external rotation. And the serratus anterior, these are the exercises for the serratus anterior, dynamic hug, serratus punch. These are the three exercises you can focus on the serratus anterior. Trapezius, there are three parts of trapezius: upper, middle, and lower trapezius. You should focus on the lower trapezius as compared to the upper trapezius muscle. And the lower trapezius exercises are this prone full can, prone external rotation in 90-degree abduction, and this prone horizontal abduction with external rotation, bilateral external rotation. This bilateral external rotation is very good exercises, and which is also strengthen the these infraspinatus and teres minor muscles. These are the exercises for the lower trapezius. So there is a in the shoulder pathologies there usually this they say that upper trapezius is more stronger than the lower trapezius. This is the pathology. So you should focus more on the lower trapezius and middle trapezius as compared to the upper trapezius. So these are the exercises for the middle trapezius and upper trapezius exercises. These are the exercises which this prone horizontal abduction and 90-degree abduction with external rotation. This is very good, creates the good mix of the strength of the lower trapezius and upper trapezius. Rhomboid levator scapulae, they are usually more of tight rather than they should not go for much strengthening of these rhomboids and levator scapulae. There are not separate exercises for these. One exercise is that this prone horizontal abduction and 90-degree abduction and external rotation. This strengthens both the lower trapezius and all other muscles also. So general guidelines of shoulder rehabilitation that you should make a good correct clinical diagnosis and initially go for the range of motion exercises, then slowly build on the strength of the muscles. The scapular plane is the much more comfortable plane to exercises instead of the frontal plane, and you should more focus on the scapulothoracic muscles and the integration of kinetic chain. That means the 50% of energy comes from the lower limb and trunk. When you are throwing the energy comes much this velocity comes from the muscles, contribute from the lower limb and the trunk. So you should focus on the whole kinetic chain. There may be problem in the any proximal part of the kinetic chain, and then you should work from less to more provocative position. For example, external rotation performed with the by the side while by the side, and then you can go for the external rotation in 90-degree abduction. So you should integrate the kinetic chain, and it is important to correct any inflexibility of hamstring, hips, and trunk, weakness of rotators of trunk and flexor and extensor of trunk and hip, and should evaluate the whole kinetic chain. In the scapular disc kynosis, you should focus more on the exercises of the lower trapezius as compared to upper trapezius. There should be these upper trapezius low. There should be low upper trapezius and lower trapezius ratio, and upper trapezius serratus anterior ratio. So scapular kinesis is often associated with thoracic kyphosis. So you should promote the exercises which promote this scapular retraction, like this retraction instead of scapular protraction. So in conclusion, the knowledge of anatomy, biomechanical, and function of specific musculature is critical in order to develop the most advantageous rehabilitation program. Goal of the shoulder rehabilitation should focus on normalizing or preventing the aberrant muscle firing pattern in shoulder pathology, and strengthening of the scapular stabilizer is important component of rehabilitation protocol, and emphasize on the posture and scapular retraction during the performance of glenohumeral and scapulothoracic exercises. This is the article. You further know which exercises you should focus in the shoulder rehabilitation. What one I will go that take home message can be, I have seen many physios doing the empty can exercises. You should focus more on the full can exercises. Thank you. Thank you.